welcome back to my YouTube channel. So I am here with my new video. This video is all about most deadly disease that is spread worldwide and cause death of about millions of people. The disease named HIV or human immunodeficiency virus. In this video I am going to discuss about its causes, what are the duration, how it affects our immune system, how it is transmitted and what are the early stages, and also its diagnosis and its treatment. So to describe this I have divided the topic into different sections. So here we go. First of all, the HIV or human immunodeficiency virus. This virus targets immune system due to which immune system fails called as immunodeficiency, and this also increases the risk of infection that our body will not able to fight. This condition is refers to as AIDS or acquired immunodeficiency syndrome. Now, when we are going to discuss about how HIV targets cell. HIV targets CD4 cell or cell that have CD4 cell molecules on their membrane. So when these molecules attack the cells, these cells include dendrite cell, T helper cell and macrophages. These are the cells that are involved in immune response and have CD4 molecules. This thus easily targeted by HIV virus. The CD4 molecules helps immune systems to communicate with other immune cells that are important when cells are launching attack against foreign pathogens. It is also important for immune system. When HIV targets and attached to CD4 molecules by binding to GP120 presents on its envelope. Now again HIV use GP120 to bind to co-receptor to get inside the cell. The most common co-receptors include CXCR4 that is have T cells, and that of CCRS that includes dendrite cell and monocytes. Now, once HIV binds to CD4 molecule, it enters inside the cell. Since HIV is a single-stranded RNA retrovirus, meaning that it infects its single strand of RNA into T helper cells. Then it uses an enzyme called as reverse transcriptase that transcribes double-stranded DNA that is then integrated into the host cell. Then when cell get attached or during any immune response, the immune system starts transcribing new HIV virus that soon come out of the cells, and it comes out to infect more cells. Now, when we are talking about mode of infection, then from infected person it enters through sexual intercourse. By this means it spread from one person to another person. The person that is infected is called as acute infection. At its early stages or during acute infection, the RNA strand of HIV which binds to CCRS co-receptor will get into the macrophages, dendrite cell and the T helper cells. Now from among these dendrite cells hang on the epithelium or mucosal tissue where the virus enters the body, captures the virus and migrate to lymph node where large immune cells lives, and all our strand of HIV essentially have the field day infecting T helper cells, macrophages and more dendrite cell, which leads to big rise in HIV replication. So this is all about the disease of HIV. Now when we are talking about its phases, it involves two phases. HIV includes acute and chronic phase. Now, when we're talking about the acute phase, it lasts for 12 weeks, while the chronic phase lasts for 2 to 10 years. As the level falls below 200 cell per cubic meter, the immune system becomes very weak, and at this stage, the condition has progressed from HIV to AIDS. Now, during AIDS, at this stage, people experience extreme fever, fatigue, weight loss, and hair loss. Now, when we're talking about the transmission, first and the possible reason of this transmission of disease includes sexual intercourse. Now, sexual intercourse include from male to female, and the second one includes from female to male. In fact, 75% of all cases of HIV are due to sexual intercourse. Now, the second reason behind the transmission of disease involves intravenous drug abuse. The third that include mother to child. Mother to child is very common and involves delivery, breastfeeding, etc. Now the fourth reason includes use of blood products called as blood transfusion. Now when we are talking about the diagnosis of disease, it involves antibody test, antigen test and RNA DNA test. The most common and the effectful method involves the screening process. Recommended test is antibody antigen test, which is better at identify early infection. When we are talking about antibody test look for the test that the body made against HIV. The second one, antigen antibody test, look for the virus directly, that it looks for antigen against HIV and HIV itself. When we're talking about RNA and DNA test, among RNA, it screens for viral RNA and also direct virus directly. About DNA test, it screens for the copies of viral RNA. So, last about the treatment. Treatment involves antiretroviral therapy or called as ART. It involves a combination of medicine which helps to slow down HIV replication and also helps immune system to recover and fight other infection more effectively. So this is the treatment and how HIV can be cured to its possible extent. This is all about HIV disease. So in this video I have discussed all about this. Thanks for watching and do subscribe to my channel. If you like the video, hit the like button. Thank you.